evolution of symptoms over a period of time that gives us the clues that this may be a mitochondrial disease than any one specific symptom. It's not reasonable for a doctor to see a child after a first seizure and say, oh, this is a mitochondrial disease. That's just not what happens. It's the seizure followed by the hearing loss, followed by the stroke-like event, and then the intellectual disability that makes one say, this is a mitochondrial disease. The first thing we need to do to establish a diagnosis is take a careful history, really find out what's going on with the patient that would lead one to believe that a mitochondrial disorder is a possibility. In addition to this medical history, we need to know about the family history. Obviously, some forms of mitochondrial disease do pass from mother to child, and often in this case, we can actually find clues in the family history. We want to measure any dysfunction or any abnormality using common and classic laboratory tests like brain MRI scan or cardiac echoes, something to give us a clue as to what may be going on in terms of mitochondrial dysfunction. We actually will measure the poisons within the body. This is done with blood and urine testing sent to specialized labs, and certain patterns of poisons. And I talk about poisons not as external poisons, but internal poisons. And certain patterns of these poisons point us into the direction of mitochondrial dysfunction. And then we can take tissue samples of the body, specifically a muscle biopsy, look at that muscle under the microscope, and see if the visual appearance of that muscle is suggestive of a mitochondrial disease or some other disease. Finally, we have genetics. You know, genetic testing for mitochondrial disease really didn't exist in 1990. It wasn't until really 2005 that I could send a test off and get an answer back in 2 or 3 weeks. We actually looked at the timeline for diagnosis back about 10 years ago. And what we found is the average patient that I diagnosed with a mitochondrial disease had been to 9 specialty physicians before seeing me. I really do think the timeline has gone down from many years to a much shorter timeline. I now have colleagues call me up, and the children are still sitting in their office asking me what I think about it, what tests I think they should run, and so the timeline actually drops to 0. Mitochondrial diseases can be treated. Right now we don't talk about curing mitochondrial diseases, with rare exception. Most often when we think about treatment, I like to compartmentalize that into 2 compartments. The first being treat the primary symptoms. So if a person's having seizures as a consequence of their mitochondrial disease, treat the seizure. Because there's very little we're going to be able to do in terms of improving the formation of ATP, that rechargeable battery, that's going to get on top of the seizure. So we have to treat the seizures using conventional mechanisms. The second form of treatment are the use of medications and vitamins that may actually improve energy formation within the mitochondria. We spend a lot of time thinking about vitamins and supplements and putting our patients on vitamins and supplements, and although in any one particular patient these may be very helpful, in the large set of patients there's no one set of vitamins that is definitely going to be helpful, and in many, maybe even most circumstances, these vitamins and supplements don't result in any improvement of mitochondrial function or any improvement in how the patient does. With each mitochondrial disease, the answer is different in terms of quality of life and duration of survival, and with each patient having a mitochondrial disease, it's different. So the patient really defines their own timeline. There are patients that I see that I could say in my heart of hearts when I meet the parents at the first visit that this is going to be a disease very likely to be fatal, often within a few years, sometimes sooner than that. And there are some patients where I say, I really don't expect this to be a progressive illness. In fact, there's some children I expect to improve with mitochondrial disease. I think the bottom line here is, although we don't have any cures right now, there is going to be hope through research. This research is basic science research understanding the genetics of mitochondrial dysfunction, the physiology of mitochondrial dysfunction, what proteins are involved, how mitochondria act with other parts of the cell, all very important in taking our knowledge to a point where we're really going to be able to help people with all of these disorders.